The kidneys are such an important organ that we see manifestations of chronic kidney disease all across the board, from alterations in blood pressure, anemia, dyslipidemia, mineral and bone disorders, alterations in potassium, metabolic acidosis, even decreased fertility and increased complications during pregnancy. And ultimately, a lot of what we're talking about is reducing the risk of kidney failure and the CKD related morbidity and mortality, such as cardiovascular events, hospitalizations, infection, gout, etc. There's a couple great tables in the KDIGO guidelines showing the same heat map that we've been talking about, but in terms of hazard ratios for certain events happening in the future. Like we were talking about with overall prognosis getting worse as you go down in eGFR and up in albuminuria, the risk of different events happening has the same pattern. These heat maps are great because you can think of CKD as a risk factor for these conditions that you see on your screen. And as we go down on the heat map from top to bottom and left to right, the risk is going to be increasing. And this is going to be for all-cause mortality, MI, cardiovascular mortality, CVA, kidney failure replacement therapy, heart failure, acute kidney injury, AFib, hospitalization, and peripheral arterial disease. If we take a sample patient with CKD G2A3 secondary to diabetes, you see the increased risk across the board for all of these events. Striking to me here was the relative risk of 33 for kidney failure replacement therapy with this patient. Their eGFR is 75, but because of that macroalbuminuria, this is a really high-risk patient that warrants treatment. They separate the table between patients under 65 and over 65, and it's really helpful information that you can use to educate your patients and familiarize yourself with why treating CKD is so important. In the next video, we'll start using some cases to demonstrate how you can put this information into practice.